Hamilton Orthopedic Surgery and Sports Medicine, providing you the most advanced orthopedic care. One of their doctors joining us on the phone right now, Dr. Russ LaFrance. Couple of sports injuries of note, and I know you've worked on athletes before. Tampa Bay Buccaneers defensive end Noah Spence and basketball star Justice Winslow for the Miami Heat, both undergoing shoulder surgery this week for torn labrums. I never even heard the phrase labrum until maybe the last 10 years or so. Is this a new injury, or are we just hearing that phrase more now because those types of injuries are becoming more common?
We're just hearing this more. It's a common injury in sports, but certainly as we become better at treating these different injuries, we become more apt to recognize them. And you're seeing with these high-level athletes and the stress they put across their shoulders during the season and during their off-season with working out and lifting, especially when you're talking about football players and defensive linemen. They put a great deal across the stress across the shoulder, which can lead to these labral injuries and labral tears.
And how are those different from torn rotator cuffs? And do normal folks experience these same injuries as well?
Normal folks do experience them, but most people who are in their 40s, 50s will experience pain from rotator cuff injuries as opposed to the labrum, where we see labral tears more when you're talking about the extremes of motion and the extremes of exertion. Most commonly, we see these in baseball players, but that's more due to overuse. We're in football or hockey, you're going to see this more as a traumatic injury. You see these with shoulder dislocations, and when the shoulder dislocates and the ball comes out of the socket, it can tear the labrum. The labrum's like a gasket that goes around the socket of the shoulder to help provide stability for that shoulder.
If you have a question for Dr. LaFrance, by the way, 624-0870 is our phone line, or text the question to 623-0373.
I do have a text question for you, Doctor, but my question is, how much does, folks who maybe made a New Year's resolution to go work out, they get to the gym, they're lifting weights that are too heavy for them, and then suddenly they wake up the next day and they're like, man, my shoulders hurt. How do you determine if it's a serious shoulder injury or maybe not so serious, or maybe it was just your, New Year's resolution injury?
Right. A lot of that's determined on how high of energy the injury is. So if you start working out and you're going to the gym and lifting some weights and you wake up the next day and your shoulder hurts, but you don't remember a specific event where I lifted this one lift where it started hurting, it's probably just an overuse injury. You've probably strained your rotator cuff and flared some of the bursa, have a little bursitis, and you should initially treat that by backing off on some of those exercises, icing your shoulder, try to keep it moving, work on your motion, and start taking anti-inflammatories.
I had a shoulder injury last year, and I got some relief from a series of injections from my doctor. Do you use that type of therapy as well before you get to the surgical option?
We do, certainly, unless there's a big tear that we know is not going to respond to injections. We try to treat these with injections, with therapy, and with anti-inflammatories, and then make surgery the last step.
But you guys deal in the wide spectrum of treatments along those lines.
That's correct.
Mm-hmm. Yep. Doc, I've said this often on the show, and maybe out of the sports world, but Dave and I, we both play sports, and I think a lot of people are in that realm where they've either had a high school or college career, and maybe when they get out of that, life happens. Things kick in. You're not as active as you typically are. And I'll never forget, but a roommate at one time, I come downstairs and I see him, he's walking around the house with his hands over his head. He's just walking around like that. I'm like, what are you doing? And he said, his shoulder had been bothering him, and he realized, how often do I lift my hands above my head on any given day when I'm not doing, something other than exercise or playing a sport? How important is that, for those movements that we're not typically used to doing and maybe we've gotten away from for whatever reason?
Well, we see a lot of wear and tear that catches up to people over the years, and then you get out of sports, like you say, you get done with high school or college, and maybe you're doing some recreational sports, and you can start to exacerbate these overuse injuries. But when they start to bother you, you'll have a lot of difficulty from rotator cuff pain, especially reaching overhead or night pain. So we see these bothering people later in life quite a bit with just regular activities of daily living. Getting milk off of the top shelf of the refrigerator or washing their hair will be common things that folks will come in complaining of from overuse type injuries in their shoulder.
When's the time to come see you? When it goes from just I am reaching for the milk and it seems to be a little sore to, boy, now I can't even get the milk off the shelf.
Right, yeah, when it's really affecting your quality of life, when the pain's not responding to these conservative things that you're trying at home with rest and anti-inflammatories like Motrin or ibuprofen, or when the pain's really severe, that's when it's time to get it checked out, to get an x-ray, and maybe time for an injection.
Talking with Dr. Russ LaFrance from Hamilton Orthopedic Surgery and Sports Medicine here on the Talk of the Town.
This is a knee-related question, but this came in from a texter. He said both his mom and mother-in-law need a knee replacement. They're in their late 70s. What would be an estimated recovery time? And also, how long is their replacement good for?
The replacements typically last 15 to 20 years. A lot of that depends on the age and activity level of the person. Having it just like you wear out your normal knee, if you put too much stress across the knee replacement, you can certainly wear that out. We hope if you're 75 and you're getting a knee replacement, that will be the only one. You're not out running, pounding on it on the streets, not doing the Boilermaker and things that are really going to wear that down. The recovery is a little bit different in everybody. Certainly the hospital stays are becoming shorter and shorter. It's not uncommon for people to go home from the hospital, but the following day after surgery, then they'll be into therapy for 2-3 months.
Now, I'm in my mid to late 50s, and I feel like eventually I'm going to need a knee replacement, and I've had 3 arthroscopic surgeries on one knee and one on another. I'm getting close to bone on bone, but then I've been told, well, you don't need it yet. Wait a while. But then there's the quality of life to consider, too.
Yeah, exactly.
Where is that line where, you're going to get it now and you're going to have a great next 15 years, and then when you're less active anyway by 70 or 80 years old, which there's no guarantee you'll reach anyway, how do you decide when to do that knee surgery or whatever it might be?
Yeah, I think you said it best. You said it comes down to a quality of life issue. So, ideally, we like to wait as long as possible, but when the pain is affecting your quality of life, these operations can provide great relief, whether it's a knee replacement or a shoulder surgery or whatever it is. They provide great relief, and then you get your activity level back when you're 50, which is great for all sorts of other reasons for your health and so forth. So, the other thing about these is if it needs to be redone, we have great ways to redo these total joints now, more bone-preserving procedures, and you can get good results, especially when you're later in life and, again, not as active and aren't going to put as much stress across that revision joint.
One question, quick. I play a lot of squash and racquetball. Could I still play those sports if I got the knee replacement?
Yeah. We like you to stay away from the high-level pounding out, running on it on the roads. But, tennis, we tell people, I'll play doubles tennis.
Okay.
Squash and racquetball would be fine.
Okay, good.
A question from a texter. They were diagnosed with scapular dyskinesis. What's the best treatment for that?
The best treatment is certainly therapy for that. You want to strengthen all the muscles around the shoulder, not just the rotator cuff, but all the back muscles that help control your shoulder blade. The scapular dyskinesis is where your shoulder blade's moving a little funny and leading to pain. So therapy, injections to help calm down the pain, and anti-inflammatories. Then the therapy will strengthen everything and get you on the road to recovery.
Is there a common English term for that, Doc, or what?
Scapular moves a little funny.
It's a fancy word for shoulder impingement.
Okay.
All right, Doc, now your tax returns. No, I'm kidding. Yeah. I said that to him on the air or off the air. More conversation. I'm not going to ask him about his tax return. But maybe back to Dave's question, and I think that it covers the broad scale of what we're talking about here today, and maybe the whole idea of what people might have in their mind when they're faced with something like this or make the decision for something like this. So quality of life, and then maybe how it affects your life. And you've been at this for some time now. So some of the advancements that you've seen, and with that, maybe how it relates to the procedure and recovery time. I'm sure there's folks out there, and you can give us the good and bad. As you mentioned, you said a lot of folks, maybe a day or two, they're out there moving around, but there might be some other folks that say, a day or two, I'm going to go out there and try to dunk the basketball again. So,
right.
So if you can give us an idea of how the advancements in the procedure has come along, and then the recovery time with that.
Right. Yeah. A lot of the surgery, especially the surgery I do, is now all outpatient surgery, especially the arthroscopic shoulder stuff. And we're able to do this with a more minimally invasive technique. We're not using big incisions anymore. The surgery times become shorter. It gives you less anesthesia and less complications afterwards. Our pain control management has become much more advanced with our anesthesiologist doing blocks now to help with pain control immediately after, which can help get your recovery going a little quicker.
Mm-hmm.
The instruments we have are certainly more advanced than they were 10, 15 years ago. The tools we have to repair these labral tears and rotator cuff tears make it make the surgeries go quicker and make the recovery a lot easier.
All right, Dr. LaFrance, if folks are looking for answers to some of their specific questions or more information from you at Hamilton Orthopedics, how do they go about reaching you guys?
They can get a hold of us, call our office at 824-1250, and we can get them and answer any questions they have.
HamiltonOrthopedics.com if you want to find out about some of the other services they offer, or look up the doc. I'm sure you'll find some info there.